Assalamu alaikum and good evening, ladies and gentlemen. Welcome to Health is Wealth, the show on PTB World that is dedicated to bring to you knowledge and awareness about health, fitness, and of course, prevention of health and disease. Today's topic is a little different from the topic that we discussed in our earlier shows. Today we are talking about thalassemia. Thalassemia is a very serious genetic disorder that infects all our children, and of course, during the course of our life, we are subjected to a lot of health issues, whether it be ourselves or our loved ones. And most of us, of course, have also seen our parents go to old age, and we know what it's like to go to hospitals. But it's a totally different story when our children suffer. And today we're going to talk about one of such a disease, which is a thalassemia. What can be done to prevent thalassemia? What are the negative sides of it? And what is being done in Pakistan to make sure that thalassemia is eradicated? So please join us after the break when we have our discussion with our analyst. Welcome back to Health is Wealth, and my guest today is Dr. TAHIRA ZAFAR. She is a consultant hematologist and the medical director, Pakistan Thalassemia Welfare Society. Welcome to the show, madam.
Thank you.
Right, madam, earlier in the studio we were discussing thalassemia, and I'd like to, my first question to you is that what is thalassemia? What are the different branches of thalassemia?
Right, okay. So let's first take your first question, which is what is thalassemia? Right. Thalassemia is an inherited blood disorder, and when I say inherited, that means it is located in the genes. Okay. And since it's in the gene, it's passed from parents to offsprings, like we have other thing, color of the skin, hair color, eye care. So similarly, the same gene is passed into a child, into their offspring. So this is what thalassemia is. What actually happens is that it's a blood disorder, it's a hemoglobin disorder in which the body is not capable of providing enough blood to sustain life in a child,
right.
And the child actually becomes anemic. So at birth, these patients who have got thalassemia major, which means that they inherited two genes from their parents, one from the mother and one from the father,
right.
They are then called as having thalassemia major.
Okay. So
at birth they look normal, but gradually, because of the lack of hemoglobin, they start becoming weak, there's pallor, there's irritability, there's fatigability, and there's growth retardation. And that's the time when this child is brought to a doctor and a diagnosis is made. And at that time, the parents actually know that they are the carrier of the disease.
So, Dr. Sahiba, you're trying to say that when a child is born with thalassemia, the parents absolutely have no knowledge until the child develops certain symptoms.
Yeah, this is the biggest dilemma here, because we have no screening system as such.
Right.
What to talk of is population screening. We don't even have targeted screening, and by targeted screening I mean screening the families which we know have thalassemia gene, and these are the families who have children with thalassemia. So if they are screened, we would know in a particular family how many people carry the gene, one gene, and they are carriers. And if we come to know that, then we can actually screen people. And if these people who have got one gene, who are carriers, get married to a person who is normal, then that means we have made the gene ineffective, right, and the children will not have thalassemia major at all.
Right. Madam, you were telling me earlier that the count in Pakistan is 5,000 patients per year.
Yes. What the statistics are, the Pakistani statistics are that 5,000 to 6,000 children are born with the thalassemia major every year. Around 100,000 people are there with thalassemia major, and when I will tell you about carriers, you would know that there are 10 million people in the population who are actually carriers. And this is because 5% of our
entire population
has this gene, and with the 200 million population, if you do the maths right, yes, you will know that it's 10 million.
So, madam, out of this entire population, how many do you think are actually aware, or what is the lack of awareness spectrum in Pakistan, if you talk about our country, because the numbers are so large and vast? There's about 10 million people who have this gene in them. So what is the level of awareness that is there for thalassemia?
As far as the carriers knowing that they are carriers, most of the people don't know. I would say around over 90% won't know that they are carriers. And like I told you earlier, they only come to know of their carrier status once they actually have a child with, with thalassemia. And at other times, sometimes, like it happened in my family, my mother-in-law was having a blood test for something else, and it was, and although that regular blood test, it was actually pointed out that she might have thalassemia gene, and we actually got it checked, and she did have the thalassemia gene. So this is what happens, either on a routine blood test, or then when you unfortunately have a child with this thalassemia major, you become aware of their carrier status. And in families who have got thalassemic children, we've actually tried to create awareness, have tried to ask them to even get the siblings of that child to test for thalassemia carrier status. It's so difficult. I mean, we did a study where we counseled 100% of the parents to bring their siblings of the child who has thalassemia. Only 33%, like 1/3, responded to that. And those are the children who are actually coming to the thalassemia center. They are having treatment there. Even they are not coming. What to talk of people who don't have a thalassemic child, who don't have a thalassemic patient. It's so difficult to bring them along. So I think if we want to test them, the best thing would be to reach them, have an outreach program, go to them rather than asking them to come to you.
Right, ladies and gentlemen, as we were discussing, this is a very serious problem, and it is growing in Pakistan, as Dr. Sahiba has very rightfully pointed out, that 5% of the entire population of Pakistan is in fact a carrier. Now, having a carrier does not mean that you are infected with any, God forbid, disease. It just basically means that in your blood there is a gene that could, if it mutates with another gene, could create this fatal thalassemic gene in your children. And earlier in sitting in a room and talking to Dr. Sahiba, we also discovered that 99% of fatalities of this particular disease happen before the age of 20. So anybody suffering from major thalassemic disease do not live before the age of 20. Dr. Sahiba, those are some very, very difficult stuff.
It's very disturbing, and it actually points out to the care which is being provided. In spite of the efforts by the government, there are in some hospitals, like in Pakistan Institute of Medical Sciences, the Thalassemia Center. Pakistan Baitul Mal has done a great job. They have developed another Thalassemia Center in F9 Park. There are Thalassemia centers in government hospitals in Lahore and Karachi also. But with that disease burden, they are not enough. A number of NGOs are working with thalassemia patients, but in spite of that, we have these figures I was telling you were from Pakistan Institute of Medical Sciences. The main problem really is that these children need blood.
Yes.
And blood is not something that you would go out in the bazaar and buy a bag of blood.
Absolutely.
It has to be donated by somebody else. And that is another dilemma in Pakistan. With the 200 million population, there's lack of blood donors for these people. And I think this is a good time in your program to make people aware that giving blood is not going to make them weak or lethargic or whatever. On the other hand, if you donate blood for people like thalassemics, but there are a lot of other conditions in which people need transfusion. So if you make a blood donation, your blood, normally our blood cells die after 120 days. So if you're donating blood, it will be put to great use. Number one, you'll feel good about it. And number two, which is the most important thing, is your bone marrow is the factory which produces the red cells. It will become more active to compensate for the blood you have actually donated.
That's
so
right.
I think
I didn't know that.
Yeah. I think I would give a very strong message to our blood donor, to our younger community, that please donate blood, because we definitely need these, and especially for these thalassemic children.
Right. Ladies and gentlemen, we're having a very tough conversation. It's a very serious conversation, and the reason, because of this show, this platform is not just designed for a healthy lifestyle. It's also about awareness, and that's exactly what Dr. Tahira is giving and imparting to our audiences today. We'll take a short break over here. On the other side, we'll continue this conversation. Welcome back to Health is Wealth, and we're in conversation with Dr. TAHIRA Zafar, who is a consultant hematologist, and today we are talking about a very serious disease, a very serious disorder that affects our children. 5% of the Pakistani population, about 10 million people, do carry the thalassemia gene in them. And of course, thalassemia is an inherited blood disorder. Children affected with this disorder cannot maintain their hemoglobin levels in the effective range. This leads to a low bone marrow count, which cannot produce enough red blood cells, and as also red blood cell survival is also diminished in time. Dr. Tahira, please tell us about the carriers. Now, what is a carrier? And if you can also let us know that how is this divided between a mother and a father, and how does a child eventually, unfortunately, get thalassemia major?
Right. Carrier actually means a person who is carrying one gene.
Okay, one gene.
One gene.
It could be either parent.
It could be either parent, either a mother or a father. But I'm at present just talking about the carrier,
Right.
which is somebody who is, it may be a male or a female carrying one gene.
Okay.
Right?
Right.
So thalassemia is an autosomal recessive disorder, by which I mean that when you carry one gene, you don't get any disease.
Okay.
That's why the carriers are silent. They don't know
Right.
that they are carriers. If a carrier carrying one gene gets married to another person who has got a thalassemic gene as well,
Right.
and when they are having children, in each pregnancy, there is a 25% chance that the baby is going to inherit both the thalassemic genes from the parents.
Okay.
So he'll now get two genes. So with one gene, there is no disease, but getting two genes makes a lot of difference, and the child now has thalassemia major.
Right.
So if we understand that carrier is a person carrying one gene, and disease or thalassemia major is a person who carries two genes. So this is the whole concept.
Right.
And when it's very important to know that you are a carrier, mainly because if you don't get married to a carrier, by that I mean if you married a normal person,
Right.
then you've actually made the gene ineffective.
Right.
It's not going to present itself as a thalassemic major child.
Right.
There will be either carriers or normal children, so no patients with thalassemia.
Right.
So the main message really here is that if you are a carrier, then you should not get married to a carrier.
Right.
And the problem in Pakistan is, and I've discussed it with a lot of parents, especially the parents of females, who actually say that if our child is a carrier and we are going to tell the prospective groom's family
Yes.
that our daughter has got a carrier status, then we'll never see
Her married off.
her married off.
Right.
So I think the awareness, when we talk about awareness, we need to make this people aware that thalassemia carrier or carrying one gene of thalassemia is normal. There is no problem except that one gene. And if they are getting married to a normal person, then there is no chance that there is going to be a thalassemic child born in that family.
But madam, do you also actually see in this time and age that actually parents are concerned if their daughter is a gene carrier, that they are in such yes, they do feel like that?
They do feel like that. And most of the time they never actually tell the prospective people that our daughter has got a thalassemic gene. I mean, like I said, the problem. So in some of the cases, what actually happens is that they get the child married off, whether it's a boy or a girl. In boys' case, it's like, as you know, in our society, it's slightly different. It's
Right.
much easier to get
Right.
boys married. So when they're married, we can actually, after marriage, we can actually check. So that is, in a way, not the end of the story that there's no hope for a girl carrying a gene that she'll never get married. After marriage also, we can check the husband. If he's a normal person, then there's nothing to worry about. But if unfortunately he is again a carrier, then what we say prenatal diagnosis, that is, we can actually, when the lady, the carrier is pregnant,
Right.
we can actually check in the first 120 days of pregnancy whether she is carrying a thalassemic major child or not. So it can be tested. And we've also got to remember that 75% of the children of this married couple who are carriers are going to be either carriers or or normal.
Right.
So 25% is a chance. The risk is 25%. 75% is
Madam, it is 25% even if both the mother and the father are carriers.
only if both the mother and the
Only.
father are carriers,
Right.
then it's
Okay.
25%.
And if it's only one, then there is
If there is
0%.
only one, there's 0% chance that there would be a thalassemia major child born in the family.
Right, ladies and gentlemen, that sort of clarifies the position. It's exactly what this program is intended for, to bring for you awareness. And the awareness tip of the day, or the most important knowledge imparted by Dr. Tahira, is this: that if you are a carrier of the thalassemia gene, you're not, God forbid, a patient, you're not, God forbid, falling in under any disease. It is only if both the parents, or the male and the female, both have this genetic disorder, even then it's only 25% chance that your child can contract thalassemia. But as Dr. Sahiba said, that it is imperative that you have a pre-screening before you have a child, because God forbid if you do fall into that 25%, then we will just talk about what happens once your child contracts thalassemia. Before we go on to prevention, Dr. Sahiba, let's talk about the cost of the treatment of thalassemia.
Yeah. I mean, the cost, when we talk about cost of the treatment, we are talking about the blood transfusion, the cost of blood transfusion, the cost of investigations. And with blood transfusion, every blood bag has got about 250 milligrams of iron, so that gets accumulated. And unless we get rid of that, there's going to be a lot of complications secondary to iron overload. So the treatment, the cost of the treatment, adding up everything, and I'm not adding up the hospital visits and this
Right.
and that and the doctor's fees and other things, comes to about 2 to 3 lakhs per month.
2 to 3 lakhs per month.
Sorry, not per month, per year.
Per year.
So you can see in our population how many people can actually afford this. And if we talk of curative treatment, which is in the form of bone marrow transplant, then it's about around 20 lakhs.
2 million rupees.
2 million rupees for a child to have a bone marrow transplant. But that is curative. That will actually, if you have got a matched sibling, you're going to be cured of the disease.
Right.
While this blood transfusion and getting rid of the iron overload, this is like temporary treatment, that whatever is deficient you're actually putting in, or whatever is more you're getting it out. So,
yeah.
But the cost.
And Dr. Sahiba also talked a little bit about the psychological damage that it has to the child and to the parents.
It's terrible. You have to see a child with thalassemia to understand that. I mean, it's really pathetic the way they are. I mean, you can imagine a child coming to the hospital every 2 to 3 weeks, getting rid of this iron, to have injections under the skin for about 12 to 14 hours every night.
Oh my God.
Or then having other oral treatment to get rid of that iron. Fortunately, we have got oral drugs now available, so people don't have, but these children don't have to get these injectable drugs only. And then going to hospital for having various blood tests. So a lot of their life is actually spent running around their thalassemia center or visiting doctors. So
and the parents as well, madam?
And the parents, and actually the child cannot go to the hospital or to other places alone. So we need parents. So it's not just the child, the parents, the family, the community, the population as such, everyone is involved in this, and it has a very negative effect on the family, and especially as children grow up, they have other sort of complication of iron overload and things. So it's a sad story.
Right, ladies and gentlemen, continuing our conversation, as Dr. Sahiba has just pointed out, that thalassemia is a very serious disorder. And of course, you can imagine if you have a child who is suffering from this disorder, the kind of pain and trauma that the child will go through. As Dr. Sahiba said, that there is a cause of iron that also compounds that you have to get rid of from your system. Of course, then there's blood transfusion, and of course there's bone marrow transplant. And of course the parents also suffer, the people around them suffer, the natural inclination of a child to grow suffers, and more importantly, there's a cost attached to it as well. In a country like ours, to imagine that somebody has to pay 2 to 3 lakh rupees a month, or 2 to lakh rupees a year, or 2 million rupees for a bone marrow transplant is of course a grave concern for a lot of people. And people like Dr. Saiba who are working for this, to create awareness, of course, at the forefront of this issue. We've spoken about the treatment. Let's talk about the prevention. That is a much more easier way of dealing with thalassemia. So, Dr. Saiba, over to you on the preventive
Thank you very
measures.
much, because that is something which is very close to my heart. We have just discussed what the cost of treatment is.
Right.
And before I actually go on to prevention, I just thought of letting you know that bone marrow transplant, as I said, is curative. And the thing I wanted to give this message, that if you have a matched sibling and you can afford a bone marrow transplant, then the best thing is to do it as early as possible.
Right.
So it is a very good response if you do it earlier, when you don't have iron overload, when you haven't been transfused for a long time and your liver is normal. The results are extremely good.
So even if you fall into that category and your child has major thalassemia, and if you go for a bone marrow transplant,
do it as early as possible.
What are the success ratio of bone marrow transplant?
Like I was saying, if you do it earlier, which we say class 1, then there is about 97% 97% success. And as you go down the class, the success rate actually drops to 90 and then 80 and then lower down. So that's why I wanted to say that if you can afford a bone marrow transplant, then do it as early as possible. So coming on to prevention.
Yes.
So we have worked out what cost it is for the patient and in monetary terms. But the other costs, the psychosocial costs,
yes,
are, I mean, you can't actually measure those costs. You only know them when you see these patients.
Right.
So with all that burden, this the expenditure and the psychosocial burden, on the other hand, if you are a carrier, the main thing is, if you are a carrier, you ought to know that you are a carrier. And how do you know that you are a carrier? It's just by doing very simple tests.
Right.
The first test to do is a complete blood picture. We call CP. Everyone is aware of that. It costs a few ₹100. So when a doctor or a specialist looked at the CP result, they can actually have an inclination that this person might have thalassemia trait or thalassemia gene, or might be a carrier, whatever you want to call it. And after this, then there is slightly special test which is called hemoglobin electrophoresis. By this, you can actually find out that you are definitely a carrier.
So that is more of a
definitive diagnosis.
Right.
So, and that will actually cost another ₹500-600 or maybe 1,000. So in about 2,000 to 3,000 rupees, you can actually find out your carrier status. And once you know your carrier status, then that brings you to the forefront that it's now your or your parents' responsibility to make sure that you don't get married to a carrier. So this is the whole prevention.
Okay.
And this happens in cases which are new, which haven't got married or which haven't yet have a child with thalassemia. So this is for either in families or in the population. And the important thing is, a lot of parents or people come to know of their carrier status when they actually have had or married, have had a child with thalassemia, and then they know, and then they see
the child suffering.
That's right, and they come to know that, oh, we are carriers.
Ma'am, is there also like a fallback on the parents when they do? Do they feel that guilt complex coming to them as well? Do you feel that?
Let me first finish this important thing I was talking about, that in those parents who actually have a child with thalassemia, it's then important for them in their subsequent pregnancies to do a diagnosis, prenatal diagnosis, which we do by chorionic villus sampling. And when I say chorionic villus sampling, I mean a small sample of the child. It's a very safe procedure. It is available in Pakistan. There are centers in Rawalpindi and other parts of the country which is freely available. It's slightly costly. It's 7,000 to 8,000.
Madam, sorry, I'd like to interject because I have a question in my mind. Is this not like a standard operating procedure? In any, if you're in the big cities, that when you have a wife or a sister who's pregnant, and when you go to see a lady doctor, do they not subscribe this as part of the SOP?
No. This is not. You don't normally need it. Right. This is only done in conditions where there is a chance that the child might have a disease, inherited disease.
Okay.
By which I mean that the genes, abnormal genes in them.
Right.
So in those parents who have a child with thalassemia, in their subsequent pregnancy, it's strongly advised that they go for chorionic villus sampling, which I said was about 7,000 to 8,000 rupees, but compare the cost of 7,000 to 8,000 to this enormous cost of the life of your child.
Absolutely.
So the prenatal diagnosis is there for couples who are actually married.
Right. Ladies and gentlemen, we're in a discussion with Dr. Saiba, and she is increasing our knowledge. Now we've spoken about the treatment. Let's talk about the role the society can play, and which that you're a part of as well. What is being done in Pakistan to create awareness of this kind?
I think awareness, when we talk of awareness, one is awareness of the general public.
Okay.
To know about thalassemia, to know that thalassemia carrier is not what we call it, a black dot on you or something. Number one, they should, and then secondly, to know what problems these thalassemic patients and their families have to go through to bring up a child who has actually got thalassemia major.
Right.
So for that, like I said, they need blood. And if you talk to these parents, you would know, they would say कि रिश्तेदार भी अब नहीं आते हैं, हमें देख के मुंह फेर के चले जाते हैं. Mainly because they would be asking for blood. And in a country where we have such a big population
and a very young
population, I think it's a pity that we don't have regular blood donors. So our society can actually do this as part of their responsibility to help these children and their families, that the blood donors should actually come forward. Number one. Number two, we have talked about the costs of this treatment, and we know the enormous costs of the patients and their families have to bear. So we need donations to help these people.
Yes, of course.
And then we actually need many centers. There are centers, there are government centers, there are centers by the NGOs, but with the burden of the disease, they are not enough. So we need more centers. So that is the role of the government really, because our younger population is suffering from this, and these are the people who are going to build up the nation later on.
Absolutely.
So we have to do something about looking after the people who have actually got it, and then most of all to prevent this happening. And I am emphasizing mainly when we are discussing also on the preventive aspects, mainly because in countries like Cyprus, in countries like Greece, where there was even a higher burden of thalassemia, they have now actually reduced it to nearly zero by just not letting the carriers get married to a carrier.
Wow.
So from that way, so it is actually a part of the awareness. So we make the public aware of what the disease, then we make the parents and the family also aware. And it's once a family has got a child with thalassemia, the family members are more receptive, and you can actually tell them about the carrier status, get them self-tested, and then in the families also, not to have cousins, a carrier cousin, marry a carrier cousin. A carrier cousin can, without any problems, marry a normal cousin.
Right.
So it's not just the question of cousin marriages. It's a question of a carrier.
That's another misnomer that people have. Yes.
They'll also, cousin marriages nahi honi chahiye, no cousin marriages, nothing of that sort. No, it's not that. The important thing is a carrier not getting married to a carrier. So awareness of the public, awareness of the patients about the disease, how to looking after the patient also, and then very important, awareness of the healthcare professionals also.
Sure.
They should be aware of the burden of the disease and how best to manage that. And then we come to the role of the government. The role of the government really is once to look after these children well, give them quality care by giving them enough, by having enough centers where they get blood transfusions and iron chelation or getting rid of their iron, and focus mostly on prevention. And there is a national control program in Punjab, but it's located in hospitals. A lot of people are not aware of it, how it's happening. So I think it's very important that this national control program should actually be implemented properly.
Right.
And once it's implemented properly, I'm quite sure that we are going to reduce the burden of the disease and maybe look in the future to have a thalassemia-free.
Inshallah. Dr. Sahiba, two questions that come to my mind. What is the urban and rural divide of this disease in Pakistan? How many cases are rural and how many cases are urban? And secondly is that we see with regards to polio campaigns, I think our lady health workers have done a fantastic job. They're going house to house and making sure that the parents are knowledgeable enough to know that their child needs polio drops. Is there any other such thing that lady health workers are employed for thalassemia as well at the present moment as well, or no?
First, let's talk about the urban and the rural divide. As I was telling you earlier, in thalassemia or in the genes of thalassemia, there's nothing like whether they would be more in urban or more in rural. So it really depends on the population, and I said about 5% of the population. So by that, it's either urban or rural, doesn't matter. The gene is there. Right. So there's in fact, what I want to say in simple terms, that there's no urban or rural divide. We see more of these patients in the urban regions, mainly because they travel from the rural areas, come to the urban areas to get diagnosis and treatment and all. But otherwise, overall, it's the same everywhere.
Right. And my second question was regarding the role of the lady health workers in
the lady health workers can play an important role. I don't think at present, or I'm not aware that at present, the lady health worker actually going out to look at these families who have got thalassemia gene in them or have thalassemia children in them. But I think that's an excellent idea that through this lady health worker, if they are properly trained and they see children in the rural regions who have symptoms of thalassemia, which I mentioned earlier, then they can ask the family to be tested and then can give them advice or direct them to the cities where they can be treated and they can be investigated further.
Right. Ladies and gentlemen, as you can clearly see that our conversation is very serious today because the subject matter at hand, of course, is also extremely serious. Thalassemia is not a minor problem. It is a very serious problem. 5% of the Pakistani people are carriers, but that does not necessarily mean that you are diseased. Especially this is concerning all the women of Pakistan, that if you do go for pre-screening or even if you're having a baby and if you do go for prenatal screening, and if your mother, I'm particularly talking about the women because this is one segment of our society that is often treated as taboo, when they go for their rights, if they want to get go see a doctor or a specialist, the parents also get concerned and all. But as Dr. Sahiba has very rightfully pointed out, that there's not a disease. Both the parents need to have this genetic disorder in them. That is 25% chance that your child will be passed on. And also Dr. Sahiba clarified that the bone marrow transplant is one curative measure, but of course the cost is approximately 2 million rupees, which of course is too much for people. So that led us to the solutions. And when we spoke about the solutions, we said that people need to come forward and donate for bone marrow transplant. People need to come and give donations, blood donations. And of course the most important is that the media in Pakistan needs to come out and create awareness on thalassemia, because as Dr. Sahiba rightfully pointed out, that you cannot imagine, and I don't want to imagine as a parent, that what a child can go through if 60 or 70% of her time is spent between needles and doctors and blood transfusions. And of course the impact, the psychological impact on that child when he or she cannot play is also playing. We're reaching the end of our program, and I'd like to take this time to ask Dr. Sahiba to give a message out to the people of Pakistan. Dr. Sahiba, what would be your message at large to the society? What would be your message to the government? What would be your message to the women population of Pakistan?
I think the emphasis of the message really is that we need to screen and find out the carrier state, and especially the families who have got thalassemia definitely should be screened. And then the second one is, once we are screened and know our carrier status, to prevent marriages between carrier and carrier,
right,
and to make people aware that being a carrier is not a taboo, it's a normal person. So this is one important message which will result in prevention of thalassemia. The second message is for patients who actually have thalassemia and we need blood for them. So I would urge our younger lot to donate blood, and it's very safe for men to donate blood 2 or 3 times a year, and even females can do that, and there's as such no problems with donating regularly. Number 3, for the government to have more centers where these patients can be treated,
right,
given quality treatment, and then government should focus, not just make a program, but make sure that the program actually works.
Right. So, ladies and gentlemen, that was our show for today. You were watching Health is Wealth. It's an exclusive program on health in English on PTV World. And we were in conversation with Dr. Tahira Zafar, who's a consultant hematologist and, of course, also is the medical director of the Pakistan Thalassemia Welfare Society. We hope that you picked up a lot from this program. Thalassemia is a very serious disorder, as I've already told you. Children get affected by it, and it can be screened, and it can be you can protect your child. You can stay away from this gene developing into a disorder, and of course then there are curable forms to deal with this disease as well. But however, the message is that the people of Pakistan must donate blood for all the existing patients of Pakistan. Every youngster who has been watching this program should realize that giving blood twice or thrice a year, it does not affect your health adversely. And also, we are most thankful to Dr. Tahira for giving us your precious time. Thank you for being on the show. Ladies and gentlemen, till next time, hope you had a more informative and more knowledgeable session with us. We hope to hear from you on our email and our Twitter handles that we will share with you later on. Till next time, Allah Hafiz.